wonderful people, good morning once again. We tell you a few minutes ago, say Health Matta go soon begin. And here we are. It don't begin. We don't start that lovely program where they take analyze things we get to do with health with person wey sabi expert, certified medical expert. I'm talking about no other person but Dr.
Always
Bat
looking dope.
Ufegbolam, CEO, Grace Valley Medical
Yes, sir.
Center, and also
Loud
medical consultant. Good morning,
Thank
sir.
you very much.
We are ready.
Welcome, sir.
So nice to be
We
here
haven't seen the
today.
house people. We knew you were going to come.
For
today.
pageantry.
I'm telling you, doctor.
Thank you very
You're
much.
looking very fresh,
You're
oh.
looking
That's
sweet.
Doctors are always
as
looking
always.
very,
That's doctor's bad habits.
I'm telling you.
It's bad habits.
They know what to take, they know what not to
Thank you
take,
for
so
your
they're always
kind
looking very
words.
fresh. Good
Okay.
to have you again,
Yeah,
sir.
thank
Doctor,
you very much.
we
Yeah.
succeeded in wrapping up ED.
Okay.
That's
Last
erectile
week.
dysfunction last
Yes.
week. Where are you taking us to this week?
Thank you very much. Good morning, viewers at home
Yeah.
and around the world. We are happy to be back this morning on Health Matter, our usual weekly program.
Tonic, yo.
Okay, yes, tonic. Thank you for that. Okay, so today we'll be looking at infertility. But today we are going to limit it to male infertility because
Okay.
it's a big topic which will take us several weeks to run through. Okay, when we are done with male infertility, of course, we'll move over to female infertility. Okay,
Balanced equation.
to balance the equation. Thank you very much. Now, let me start by saying that by giving an overview on what we're going to talk about this morning. Number one, we'll do the introduction of the topic. We'll make a definition. We'll talk about the spread, talk about the epidemiology, the signs and symptoms, what causes it, risk factors, diagnosis, as well as investigations that can be done along that line. If time permits us, we can go as far as treatment. Okay, so but let me start by saying that male infertility is a challenge that has a global affectation. It's being said that 1 in every 6 couple has challenges with infertility. But when the fertility has to do with a male factor, we narrow it down to male infertility. What then is male infertility? The inability of a man to cause pregnancy in a fertile female over a period of 1 year. The inability of a male to cause pregnancy in a fertile female over a period of 1 year. Now, when we talk about periodicity, we also need to talk about adequate sexual exposure. Adequacy in sexual exposure is important. Okay? So I want to rephrase. The inability of a man to achieve pregnancy in a non-contraceptive female over a period of 1 year. Okay, so if we have that, we are dealing, and if it has to do with the male factor, we are dealing with male infertility. Okay, so, and it's being said that 30 to 40% of all causes of fertility have to do with male infertility. Okay, now I want to give us an overview so that we'll be able to understand the causes. We said before now, talking about the anatomy of the male reproductive organ of the penis. A man has a penis surrounded on either side by 2 testicles, okay, which usually is housed outside the abdominal cavity by the scrotum. Okay, so when we discussed about erectile dysfunction, we talked about the anatomy of erection. Okay, but this morning we'll be taking it to what happens, the events that usually play out in ejaculation. Okay, now imagine having a testicles with a penis. In the act of sexual or coital exposure or sexual intercourse, when the man must have achieved erection. Okay, with adequate stimulation, impulses usually are sent to the nerves and all the way down to the brain. Okay, so at the climax of sexual excitement, okay, that's the central nervous system bring about a trigger that actually causes ejaculation. But to understand this, I want to give us an analogy, okay? Those of us who have traveled by air before, it's just like the picture you have when a plane is about to take off, okay? Number one, the plane, after the plane may have, after all the passengers would have boarded the plane will gently turn and then move towards the runway. That is the first phase of what happens in ejaculation. Now, when it gets to the runway, the engine will increase in intensity. And of course, there is a takeoff that happens.
Speed.
With speed. Okay, so now, in ejaculation, you have something similar. Don't forget, the testicles actually produce the sperm. When we talk about sperm, I want to make a difference between sperm and semen here, so to enable us to understand. Now, the sperm narrows down to just the sperm cells only, without no plasma, without no seminal fluid associated with it. So usually, the production of sperm takes place in the testicles. Okay, so in the act of sexual or coital exposure, what happens is that there's a form of contraction, muscular contraction within the testicles that pushes out these raw sperms. It pushes it out through a tube that is called vas deferens, just like a plane moving to the runway. Okay, so that's the first phase. Okay, we have a picture that is showing before us now, and then you can see the, I don't know if you can see the arrow. There's an arrow here that is moving up. So from the testicles, through the vas deferens, the sperm, through the contraction that has pushed it up, goes to the back of the penis. As it gets to the back of the penis, the accessory organs, the seminal vesicles, the prostate, and bulbourethral glands, will secrete, push in their secretions from the sperm that has emerged from the testicles, and that is when you have a semen. So that is the first phase. Okay, that first phase is actually called the emission phase. Okay, now when it gets to that level, ejaculation at this stage is unstoppable. Now the next moment, which I likened to take off of an aircraft, is when the muscles that are usually at the base of the penis will contract and then forcefully push out this semen out of the penile orifice. Of course, into the in the course of sexual intercourse, of course, it will be into the vagina of a female here. Okay, but that can also happen in when you do personal stimulation. Okay. Now, when that happens, the semen is ejected, not just the sperm. So, what that means is that the vehicle that carries the sperm is the semen. So, it's not just the sperm that make up the semen. The secretions from these organs that we have mentioned a while ago, the prostate gland, the seminal vesicle, the bulbourethral glands, are all what are added to make up the semen. And usually, for a normal man, in an ideal situation, the volume that a man pushes out will have to be in the neighborhood of 2 to 5 mils. 2 to 5 mils. If it is lower than that, there is a challenge. Now, what causes male infertility has to do with, number one, production of the sperm, transportation of the sperm, as well as movement. Now, I want us to have the picture that was displayed a while ago so that you can understand. Now, anything that can bring about, anything that affects the testicles unduly, there are a number of medical conditions that can actually cause either low production or cessation of production of sperms in the testicles. Okay, we are going to mention a number of medical conditions along that line. There are also causes that can prevent normal transportation of this sperm that is coming out from the testicles before it joins the other fluid to make up the semen. Okay, so if the transportation has issues, a number of medical conditions too can cause problems with transportation of the sperm after production. Also, from the base of the penis, when it goes through the urethra to the exterior of the penis, there could also be issues too that can affect the transportation. And of course, the movement of the movement of the sperm itself when it gets into the female body too, I'm talking about motility now,
Motility, yeah.
okay, will also be affected depending on the quantity or the viscosity of the semen that has come out of the situation. So, the causes of male infertility that affects the testicles, number one, you have diabetes. That can happen. Apart from diabetes, there are a number of other causes too that can affect the production of sperm. When we talk about the testicles, you can equally refer to it as a gonad in the male. It's just equivalent to the ovaries in the female. Okay. So that is the situation we have. Now, apart from the fact that the number of medical conditions that can bring about reduction of or that can equally affect production of sperm from the testes. These include things like infections, infections like chlamydia, gonorrhea, HIV. Okay, this can actually cause, in some situations, it can actually cause destruction of the mechanism of spermiogenesis. So, such an individual may have low sperm count. Okay, apart from the infection that we talked about, there are also some genetic conditions that also can bring about a reduction of a reduction in the production of sperm. Genetic conditions like...
Sorry, sir, just to ask, when you say reduction in the production of sperm, is it also likened as the reduction in the quantity and quality of sperm? Because they are two different things. So
Yeah, thank
are
you
you
very
shooting
much.
at the same now?
Now, the reduction, thank you for the question, sir. Now, there can be reduction. In the case, if you have reduction, the person could have what we refer to as oligospermia. Okay?
Yeah, the sperm.
There's also, apart from reduction, there could be a total absence of sperm
Okay.
within the testicles.
Total absence.
Total.
Yes, total absence. That can happen when we have that condition is referred to as azoospermia.
Okay.
Okay, so some genetic conditions can actually, usually, most of the challenges that bring about oligospermia, that's low sperm count, most of them sometimes will have to do, apart from infection that we mentioned, we also have to do with genetic abnormalities or genetic conditions. Okay, something like Klinefelter syndrome that can occur in the male. Ideally, a man should have an X and Y chromosome, but in Klinefelter syndrome, a man will have an additional copy of X chromosome. So any man born with such an abnormality will have challenges making with the production of sperm in such a person. Some other rare medical conditions like cystic fibrosis too, okay, can come down. People who have this condition can come down with affectation, okay, or male infertility, if you like. There's also
Sorry,
challenges.
sir, just to ask, what is cystic fibrosis? Sir? What
Now,
does it mean?
cystic fibrosis is a hereditary condition that has to do with abnormal production of mucus. Okay, usually the presentation is something similar to sometimes people who have asthma, they have difficulty in breathing, so they wheeze. Okay, so cystic fibrosis can present with chest symptoms, oftentimes wheezing. Okay, it produces mucus that usually clog up the respiratory airway. Okay. People are born with such congenital abnormality, and when that happens, it affects sperm production in such an individual. Okay. So there are a number of other conditions along that line, but we want to deal commonly with. We want to look at what occur more commonly in our environment. Okay.
Which is
That's the one that is very common in our own domain here.
Yes. Now, the commonness is said to be a condition known as varicocele.
Okay,
Okay?
varicocele.
Yes. Now, varicocele has to do with swelling of the venous plexus, okay, within the scrotal sac.
I was about to ask, sir, because ever since we've been treating erectile dysfunction, now we are on male infertility, the question has not popped up. So it popped up this morning that I should ask, does this varicocele also mean that thing we see that we call Yoruba call it ipa, but I don't know the English, where the testicles will be unnecessarily swollen and it will be so big.
Okay, no, I think I know what you're talking
Okay,
about.
but before you talk about it, let's go on this break. We shall be right back. Go nowhere.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Welcome back to the show, still Health Matter with Dr. Bat Ufegbunam. And before we go on that break, it was about PCCing varicocele to us. But before I talk about varicocele, I ask a question as a thing that has to do with the swelling of the testes, where Yoruba they call it pa. She not the same thing with varicocele. I'll be waiting at the call for medicine.
Oh, okay, thank you very much for that medical question. I must also point out. Is referred to as hydrocele.
Wow.
Scrotal hydrocele. Sometimes you see a lot of people on the streets, a lot of people who should be in a hospital setup receiving treatment. You see them trying to make a living out of it.
Yeah.
Okay, so we can't deny the fact that we see them from time to time. Okay, so that is called scrotal hydrocele. It's not the same as varicocele. Now, varicocele has to do with abnormality in the veins that usually drain the penis. Usually, if you've been regular on this program, you know that we've said a lot of things about varicocele in time past. Arteries usually push away blood from the heart to all other organs of the body, but veins return the blood back to the heart. So we have venous return. So varicocele affects venous return in the scrotum. So varicocele is an abnormality that has something to do with the veins. And usually it's believed that it brings about challenges with temperature regulation in the testicles, which will adversely affect sperm production. But it can also be reversible by way of surgery, okay? And it's been said that it is that about 40% of men who have challenges, 40% of men with infertility may have challenges that have something to do with varicocele. Okay. Recently, a young man of about 30 or 35 years of age had a surgery in my own center on account of varicocele. Oh. And over a period of few weeks, there has been some good improvement in the outcome, in the sense that somebody who was having challenges with azoospermia can now boost of sperm count in the neighborhood. I think we have a caller. Mark from Adamawa. Mark, good morning.
Yes, good morning, doctor.
Good morning, sir.
Good to have you on the show.
Thank you so much. Actually, at the point, I was no longer hearing you because the sound ceased.
Okay.
Oh,
sorry about
couldn't
that.
hear us again. Okay, so but then what do you want to know? Do you have questions?
Can you hear us now?
Yes, I'm with you.
Okay, so
thank you.
You get questions to ask.
Yes, I have questions to ask.
Please feel free. Go on.
Is that right? For some time, actually, my wife and I had a baby 2 years plus now.
Okay.
but we are still, she had a challenge, ectopic pregnancy, and that is almost a year plus now. And we have been expecting to have another child. It's not happening. She has done series of tests, and they say there's no problem. And I also want to go for a test, but the doctor, there was no need for that. If we have had another baby that day, I don't think he doesn't think that there's any problem with myself. So what do you think is the possible problem and solution?
Please hang on. Don't go. I have a question for you. The ectopic pregnancy, did she go through surgery?
Yes, she went through surgery. That was done successfully.
Okay, thank you very much. You've given me enough information to work on. Thank you very much.
That's clacking.
Yes. Okay, so unfortunately, in most cases, for people who have had ectopic pregnancies, they usually lose one fallopian tube. In some cases, it could be salvaged in places or in centers where the facilities exist. But oftentimes, anybody who has had ectopic pregnancy before, such a person has actually lost a fallopian tube. And of course, every woman has two fallopian tubes on either side. Okay, so ectopic pregnancy, for people who may not know, is when you have baby, a baby that is developing in an abnormal site outside the womb. That is the simple meaning of ectopic pregnancy. So early on in when fertilization occurs, within days, there will be mitotic, all forms of cell divisions will start occurring, and of course, the mass will start getting enlarged. And as it's getting enlarged, the baby that is forming, it begins to travel from where the fertilization occurs, usually the fimbrial of the tube, and then it follows all the way through and begins to roll down, trying to get into the womb. In some cases, infection that may have caused scarring within such tubes can impede the passage of that developing embryo, and it gets trapped. For some unknown reasons, it may not be able to get to its destination. The destination is actually the womb. Okay, so it stays there and begins to grow. And of course, if it gets bigger, the tube will burst.
Yeah. Sure.
And it's a medical emergency. One of the things we were taught in medical school back in the days in OAU is that if you have a woman as a doctor in your clinic, and the complaint is that this woman fainted and she's in reproductive age group, you must make a diagnosis of ectopic pregnancy until otherwise proven. If you fail to do that, before you're getting yourself together, you may lose the patient. So it's usually a medical emergency. The intervention is usually very fast. We have Sunday from Lagos.
Sunday, good morning, sir.
Good morning. Good morning.
Yeah,
How
good
you
morning.
doing?
Sunday.
Yeah. Doctor is here. Go ahead with your question.
Okay. Sir, my question is that concerning infertility.
Okay.
Like, I have a sexual intercourse with my wife, and at the end of the day, the sperm, when after ejaculation, the sperm will come outside. I don't know whether it's an issue for that. The sperm will come outside, and my wife is complaining, say, why the sperm is always coming outside? Almost, we have issue of he has not been taken in. So he's complaining, say, why the sperm is coming outside? And I believe that not all the sperm that enter woman's body, but the one coming outside, I don't understand it. So is it an issue?
Thank you very much. Thank you very much.
Thank you,
Yes,
Sunday.
it's an issue. It's an issue, but quickly, let me be done with the previous question. Okay, so that we can come down to this. So what I can say is that your wife can deliver the number of baby that you people may desire to have with the tube that is remaining.
Okay.
It doesn't stop anything. She can have, if you desire to have 10 more babies,
Wow.
that is still possible with one single tube.
Okay.
Okay, so anybody who has had an ectopic pregnancy before, there's a warning for you. If you get pregnant, quickly get your doctor. Early on, so that the person can be monitored very closely.
managed,
Because if
yeah.
you end up with a second ectopic pregnancy, that means you've lost 2 of your
Yes.
tubes. Okay, so your
That's-
only opportunity to have a baby may be resorting to IVF. Okay, natural means may be out of the picture. Okay, so coming back to the last question,
Sunday's
Sunday's
question.
Sunday's question. I want to point out here that it's not usually all the semen that end up getting into the body of the female.
Yeah.
Not all. It's impossible for all of them to get into the body of the female. And in actual sense, what we actually do the fertilization will just be one single sperm cell. But in cases where you have
But most times,
twin
doctor, we don't have
gestation,
it. We don't
when
have
you
it
have
that
twin
way now.
gestation,
Yeah.
you could have many fertilizing at the same time. But permit me to also point out that experience has shown that people who have low sperm count, they usually have watery sperm. And this is usually what pushes out. Okay? So I've seen women coming to me, and doctor, my husband has this problem. I know what the real thing looks like, but this one is not it.
Sir,
Maybe it's supposed to be
Okay, so
sick.
what I can say is that further evaluation is
Has to be
needed
done. But
by your doctor.
Okay.
Okay, you need to be subjected to a number of medical investigations, seminal fluid analysis. Don't forget that it takes about in the neighborhood of 15 million to 200 million. Some studies say 300 million.
Spermatozoa.
Yes, sperm cells can actually be found in someone's ejaculate.
Well,
But you should have at least 15 million per mil,
okay.
okay, of sperm in semen. When we talk about sperm, I've differentiated sperm from semen,
Semen,
so we know what it is.
But doctor, what's the difference between poor ejaculation and low sperm count?
Ejaculation, low sperm count has to do with the production. It's a problem that has to do with the production of sperm.
Okay, low sperm count.
Okay. If for any reason the testis is not producing enough or has some impediment that is making it not to produce enough, such a person can have low sperm count. Okay, but
There's a spermia.
yes, but when you talk about ejaculation,
Poor ejaculation.
you could have a number of ejaculation problems. Okay, one of which is poor ejaculation, which you have mentioned. There is also what we refer to as retrograde ejaculation. So one of the causes of male infertility is ejaculation problems. So now that you have brought up the question, we should dwell on it. Now, retrograde ejaculation is a condition. Remember the analogy I cited at the beginning, a plane that is about to take off.
On the runway.
Yes, on the runway. So you have the emission, and then you have the pushing out that comes. So when at the time it takes about 0.8 seconds for the ejaculate to be pushed out for the ejaculation to occur. Don't forget is central nervous system is an act that is controlled by the central nervous system. Ume from Lagos.
Ume, good morning.
Good morning to you, sir.
Good morning. The doctor is here. You can go ahead with your question, sir.
Thank you very much.
Yeah, thank you, Mr.
My
Ume.
question is that I have a result of low sperm count. So, but previously I have almost half. About some years ago, as I tested it, then recently I go for the test as I'm just looking for, as I'm just trying to get a baby. The result I get last was showing that there is nothing in the sperm. So I just want to ask the doctor to help or to enlighten me more about that.
Okay, thank you very much, sir. Thank you very much. If I got you right, you already have a baby, but you desire to have more.
I don't have at all.
Okay. Thank you very much. So we are dealing with a case of primary infertility. Primary infertility is in a situation where the couple have not been able to achieve pregnancy for the first time. Secondary infertility is a situation where they've been able to achieve. They have live babies, but subsequent efforts to have more proves abortive. Okay, so that's secondary infertility. And I also want to point out that secondary infertility is usually a lot more easier to manage and resolve. But that is not to say that primary infertility cannot be managed with good outcome. Okay, but usually in doing so, we usually keep an eye on the age of the individuals involved. Okay, so in a situation where one has, he did before, he had some sperm count that was quoted, and then the letters he has on his hand, there is nothing again. There is a problem, okay? And I think you need to see a urologist, as well as an endocrinologist, okay? You need to be further evaluated, okay? Your problem could be varicocele that we just talked about, which we said that is responsible for about 40% of cases of male infertility.
That affect the veins.
And it is reversible. I said that as well. It's reversible, okay? A lot of people have done surgeries, which we did in my center recently, not up to 2 months, and we are getting good results.
Good one.
Okay, so these surgeries are specialized surgeries that are usually done by urologists. It's not an all-comers affair. Okay, so I need to point that out. So, but what I'm saying, my advice to you is that you need to be further evaluated, sir, so that whatever the problem is, it can be identified and as well as solved.
Okay, Dr.
Thank you
Bat,
very
I
much.
think to really attend to Ume, because it's because of you we are seated here. May doctor's profile will be displayed on the screen now. You can always copy the number and talk to him. Give him a call after the show, though, for further evaluation. You can always count and trust, and he will talk to you better.
And as a matter of fact, it shouldn't just be Ume alone, because I know say we get some people who say they do not really like to ask their questions while we do on air. You know, they want make them confidential. So the lines are actually opened after the show. You guys can always talk to doctor, and I know say good day there to answer you guys.
Too?
Does he do WhatsApp?
Okay.
Does he do WhatsApp?
A lot. He prefers
I know the
WhatsApp.
doctor said
Call
just
him and you're on your own. But WhatsApp, good.
Okay, so
Thank you very
doctor,
much. So you took us to ejaculation problems. That was where we stopped before we started.
I'm sure it's part of what we are discussing.
Yes. So
Now,
you were talking about retrograde.
Yes, I was talking about retrograde, and I said, remember the analogy we cited at the beginning, okay? When the plane is about to take off, instead of having a forward motion, what you have is a backward motion. It reverses.
Yeah.
So instead of the sperm coming out to the exterior, to the outside of the penis, it pushes into the bladder.
That's retrograde.
That is retrograde ejaculation. Like I said, the components individually are affected, and there are several medical conditions that can affect them individually. Apart from retrograde ejaculation, somebody asked us last week about premature ejaculation. Okay, so I want to say that one of the challenges that can occur with ejaculation problems is premature ejaculation, PE for short. Okay. And I can tell you that is one of the most common disorders, sexual disorders or sexual dysfunction that affects men that are below 40 years of age. Okay. And I can tell you that a lot of people have this challenge. And this premature ejaculation usually are of two types. Okay? You have the lifelong premature ejaculation, which is usually referred to as primary PE. And then you have the acquired one.
Doctor, the way you're making it look like now is already appearing like a challenge to me. But then, is there a particular number of hours, minutes, whatever it is that a man is supposed to last? No, seriously, because for me, it's all about you know, being fertile. So if he does it and he has a child or he has children to that effect, is there a problem for any time he comes or whatever time he chooses to come?
Okay, I think to complement the question like I have here, there are two questions here. Doctor, if a man attains 5 minutes of sexual satisfaction, I'm not talking about semen production, I'm not talking about the chemical anatomy of this, but the 5 minutes, a man is able to keep a woman on for 5 minutes, he attains erection. Sir, can we say is...
Or he's under poor...
Can we say...
We have Musa from Gobe.
Let's take that from Musa from Gobe.
Musa, good morning.
Good morning, sir.
Yeah,
How are you doing, Musa?
Fine, sir.
The doctor is here. Please go ahead with your question.
All right, sir. I want to ask two questions.
Go ahead.
Free.
My first question is, I read from somewhere that using laptop, teaching on your
Laps.
manhood site, laptop,
Yeah.
on your laps,
Yes.
it affects a manhood
and it causes infertility. How true is that, please, doctor?
Okay, second question, please.
Yes, the second question is the low sperm count. You mentioned so many courses. Please, can you repeat it for us? Because I come from so late, because I normally listen to this program, and I will advise you, please, because this your program is gaining more attention
Thank you very
nationwide.
much, sir.
Please, can you display your Twitter handle so that at least for us to be following you? Please, apart from WhatsApp, that this young lady, she's advising that, madam.
Thank you very much. Thank you very much. Let me start from the last one, sir. Thank you very much. We thank you for your kind words. We appreciate your support. From the last one, because of some medical issues, okay, there's a limit to which addresses can be put up when a doctor is involved. That is why you discover that it's just my name and a phone number, usually without any address. I must point that out. But WAP TV has done fantastically well in that all our presentations can be watched on YouTube.
Yeah.
All you need to do is just to go to YouTube, Google Health Matter videos.
Yeah.
Okay.
Comes up.
It pops up. You see all the previous presentations that we have done. Okay, I think from last year, a whole lot of them down to this. Okay, so every at the end of every week, they will upload. It's been updated. Okay, just like that. So if you miss out, you can hook up on Wednesday night by 10:30 p.m. If you miss that again, you can also go to YouTube
and watch.
My Twitter handle and all whatnot. I'm not sure medical authorities will allow me to display that, so that it doesn't become advertisement for myself. Okay, because the essence is the importance is for the sensitization and the health awareness, not about me as an individual. Okay, so usually when people call me, they call me from outside the country. I get calls from Libya, Benghazi, South Africa, Ghana. Usually I will advise them to go see doctors in their own places. I just guide them in the see so and so doctor, see so and so specialist. This is who you need to see. Okay, so just help. Okay, thank you very much.
So
now
let's answer his question.
Yeah, the question is on
laptop
on the lap. Thank you very much. Now, on a practical note, I will say this here. That question is very true. Very recently, in my own consulting room, I have a wooden table. So one of my doctors placed his laptop, usually because of the heat. He carved a mark there. The color was removed. So the places where he placed it, you see the mark of the batteries.
So how much more is it?
Wow. How much more when you have that on your lap? Okay. One of the causes, some of the causes that we are still going to talk about are environmental factors. Okay. Under environmental factors, you have things like things that can cause overheating of the testicles. God, in His infinite wisdom, actually developed the scrotum to be outside the abdominal cavity for a reason. That is why the scrotum has a different temperature from the internal body temperature. So if for any reason you have anything that can overheat that place, be it staying long in hot bath or hot saunas, you're actually doing yourself
no good.
You're actually damaging your fertility. You're actually reducing the quality of your sperm. Don't forget, recently we talked about undescended testicles. People who have children who are born with undescended testicles, if they're not brought down on a good time to the scrotal sac to where they should be, their fertility ends up being affected along the line. Years down the line, their fertility is affected. So one of the causes of male infertility is undescended testes. But I want us to finish with premature ejaculation, because that was where we left it. Okay, we are not running. Okay, now, so premature ejaculation. I've talked about the fact that there's a lifelong PE, and there's also the one that is called acquired PE. Now, the one that is lifelong dates back to the person's first sexual experience. You discover that from the person's first sexual experience, coital experience, he has always been having this problem. Frequently, always. That can be caused by psychological abnormalities. Sometimes when we are growing up, we get into trouble, some form of sexual troubles that can adversely affect our image or our perception about sex. And of course, it stays with us for the rest of our lives. Some people, it affects them emotionally. The emotional trauma that comes with it can actually lead to a lifelong premature ejaculation. But for acquired, this is for someone who has been performing creditably
then all
well.
of a sudden,
And along the line, he start having these challenges on frequent basis. On frequent basis. Permit me to also point out that all men, at one time or the other in our lives, we usually come across premature ejaculation. Some of them can be related to anxiety disorder or performance anxiety. Sometimes when we have a new partner and we
want to impress.
Yes. And then sometimes when you're into the act, you're nervous and all that, you're distracted, you're nervous and all that, okay, so that can actually happen. Okay, that can actually affect. Okay, so
Well,
behavioral, yes, I'm getting signals that we should be rounding up. But next week, we are going to start from treatment of premature ejaculation. Okay, behavioral changes that we need to do so as to overcome these things. You'll hear more on that next week.